right. Let's see, that is not where I'm sharing. Right here. Are you guys seeing the WCHD COVID-19 response?
Yes.
All right. So first of all, I just want to say it's so nice to see everyone's faces. It feels like it's been forever. Sorry, I've been a little MIA lately, but as you will see shortly, we have been keeping busy over here. So we're going to start off with some introductions, and I'll go ahead and let my team do that with Doug.
Thanks, Alana. Doug Guerin, Director, Health Officer, Winnebago County Health Department. Nice to see you all again, too.
Hi, I'm Kim Gofford. I am the Communicable Disease Supervisor for the Winnebago County Health Department, and nice to meet you all, although I do see some familiar faces.
Hello, I'm Nikki Uhardy. I'm the Policy and Equity Coordinator with the Health Department. Also was a league member, might still be, not sure, so a lot of you look familiar.
And my name is Alana Erickson. I'm also a supervisor here at the Winnebago County Health Department and a league member for over 4 years now. So glad to be with you guys today. We're just gonna kind of jump right in. Just a reminder today, we are not going to spend a lot of time on the data, the details of what COVID-19 is. We're going to assume that you did your homework and are versed up into that point so we can get into more of what's happening locally, how our health department had to adjust in March and continues to adjust as the days go by. Kind of share some information with how you guys can help our efforts and help our community come together around this issue rather than become more divisive. And then we will definitely be including some time for Q&A towards the end. We did get 6 questions submitted prior, and we'll make sure that those are covered when we get to that portion, but also know that there will be definitely time that we've built in for questions based on our presentation. The best way that that's going to be formatted is through the chat box. So if you have questions, just be ready with those and you can type them into the chat at any point, okay? All right, so Doug's going to kind of jump in with this and we'll supplement his presentation as we go.
Yeah, thanks, Alana. So just to kind of review what impact COVID has had on the health department, we have a little less than 50 staff normally, and we've really reallocated the majority of our staff to COVID in addition to hiring a considerable number of other people. About the only division that is somewhat intact in terms of normal operation is WIC, and even their normal operation is now entirely virtual. We certainly had some suspension of our services related to restaurant inspections after restaurants were closed for a period of time, and then just the reallocation of staff, all our nurses, working on contact investigation and disease investigation. Many of our other support staff really manning hotlines, answering public questions, filling in other areas related to COVID for planning and policy and orders, and responding to media and pushing out information, collecting data. And many staff are not doing what their routine roles normally are here, and we continue in that. I think we've hired already at least 17 additional staff on top of our regular workforce, and we'll continue to be adding capacity as we see cases rise and demand for our services to continue to go up. The county buildings are just starting to open back up, and as a result, many of our practices and services, direct services to the community, have been suspended. And where we are trying to do right now is start planning to restart some of those services that are most needed, and increase capacity so that our staff can get back to some of the more routine work that is still very important but has been put on hold these past few months. Next slide. So I want to just touch on what the primary areas are that we're working on related to COVID. And there's roughly a handful. Probably the biggest area and most important is the public information. getting information about this situation out to the public, providing guidance, providing consultation, providing recommendations in lieu of orders at this point, of course, to help the community understand the outbreak, understand what they can do, and to engage the entire community in a response. This really is a, it's a community-wide issue, and it requires the entire community to respond. And so some of the ways we do that, is through our website, through our situation report, through media, through social media, and lots of consultation. Staff have spent a lot of time working with the university, with school districts as of late, prior to that with businesses, and we still continue to target information to various sectors. Another bit, so that's probably the most visible side. The least visible side is probably our case investigations. So every positive case that comes in that gets reported is reached out to within 24 hours. And we attempt to reach those people, let them know that they're positive, and make sure that we identify their contacts and do contact investigations. This is where many of our staff are working currently. We have roughly 10 to 12 nurses that are working on disease investigation, actually contacting people with positive tests. The 17 other contact tracers working on either data importation with our electronic disease surveillance system, or contacting those contacts for those cases, those case investigations. And there, again, our goal is 24 hours after identifying them that, we've made some contact with them. We can't always reach them all, but we're always trying. And so our goal is to, within 24 hours, have that happen. Also is to maintain a system for isolation and quarantine. Some individuals that have disease cannot safely stay at home for a variety of reasons. And there are close contacts that need to be quarantined that may not also be able to stay at home. So maintaining capacity in terms of, in our case, hotel space, which we're really sharing as a regional resource, is an important piece of what we keep in place. Testing coordination, trying to help assure that we have enough testing within the community has been quite a challenge. We know that we don't have enough testing right now. And we continue to work with healthcare systems, the state, and other new partners. And so we'll hopefully be bringing on some new community partners in helping with the testing shortage. We have to have testing in order to be effective in doing our contact investigations, our disease investigations. It's only once we get that positive that we know we have someone to contact and try to limit spread that way. So it's really our first line of defense is that initial disease investigation, and it requires testing to identify those positives to make that happen. The other area is data. We collect a tremendous amount of data and have to process a tremendous amount of data. Sarah Jean on our staff has been working essentially full-time and not a role that she's had before, being our resident COVID epidemiologist, and really helping us crank out the stats and do the tracking and present all that information to the public and help us and the public make decisions about moving forward. And then lastly, I wanted to mention, hospital capacity as well. The testing, contact tracing, or disease investigation and hospital capacity are all linked together. The more testing we have available, the better we can respond and limit spread. And then that puts less burden on our healthcare systems. So healthcare systems are important on the testing and on the hospitalization capacity ends. And so we really need to work closely together to help assure that we're maintaining enough capacity in this community to respond and that we don't overwhelm our local resources. I know I talked off the slide there quite a bit, and so hopefully you're reading that. And you can see some other pieces there that are really important with the work that we do. The guidance piece, the reopening guidance, the policy updates. Nikki's been amazing in helping us, understand where we're at, working with Corporation Counsel, helping understand what it is that we're, able and not able to do is a really important piece and very challenging piece. We never thought we'd be in the position with having state statutes related to communicable disease be questioned in terms of what health department authority is, and to be able to respond appropriately to help stop this this pandemic at the local level. And I'll leave it at that.
Jim, do you want to add anything as far as CDT, rather, not that you need to?
I think Doug covered it pretty well, and I can just wait and see if there's any questions that pop up later in the presentation.
Right, sounds good. Then we'll keep going through.
So Doug touched on this a little bit already, but just wanted to talk briefly about public health policy. As many of you have probably heard, public health is built into our government structure through state statute. Our duties and authority are outlined in state statute and have been for decades. However, we have been having some issues with that, as has been in the news. I'm sure many of you saw that with the Supreme Court ruling on the Safer at Home, which is now kind of put us in limbo land for local orders and local authority. So we've had a lot of ups and downs over the last 6 months related to public health policy and local orders. And at this point, unfortunately, health has become very politicized. It's turning into a partisan issue when it really shouldn't be. So we've had some issues with that. We really, especially now with the mask mandate, our focus is on education, not necessarily citation. We never want to have to enforce or do any citing. We really do just want to be able to focus on the education. And typically we do get people to comply that way. We do try also to make sure that our our guidance is very localized. That helps match our community response. But it's also helpful that we have state and federal guidance, and when that comes out, it's more easy to enforce and provide that education when the behavior is more normalized. For example, with the masks, if you see a lot of people out wearing them, that becomes more of the normal behavior. So we don't necessarily have to do any enforcement of that. There might be questions on this related to the Supreme Court ruling, local authority. There's been a lot of confusion around this topic. So happy to take questions at the end if people do have questions.
So when we thought about, how to talk today and present and what we want your help with, it's really just helping people realize that the health department is here. We're nonpartisan. We are here to prevent, promote, and protect the health of Winnebago County. So we're your reliable local data, and we're gonna help lead this effort as a community. If you're looking for data, we have a dashboard on our website that's updated daily. This is a little screenshot of our dashboard. Whoop, I want to go back there. And it's interactive. There's a YouTube video on there of how to utilize the dashboard best. So if you're ever in a situation where you want to make sure you've got our local data and it's real, go straight to our health department website. We do send out situational updates, not only to the public, but also healthcare providers, schools, other groups that have more specialized information, and those can be signed up for on our website. So I've put all of this information here, how to contact us, how to send stuff to us. We do have a complaint form on our website for those folks that are noticing some activity that's going on. You don't always want to be causing a ruckus or sound like that squeaky wheel, but maybe it's just something better for the health department to know about. And as Nikki indicated, we usually follow up with education. We're not trying to be punitive. Sometimes there's just confusion or misunderstanding about what best practice is. So we try to intervene in a calm, controlled way. And a lot of times people are more than happy to change the way that they're operating to make sure that they're following the guidance. So those are some of our resources. If we have time after Q&A that we're sitting around, I will open up our website and kind of navigate through some of these tools to show you guys a little bit better glimpse. But considering our limited time, I want to make sure that we can get through all of our questions. So here is the first slide. We had a lot of questions related to the reporting of deaths related to COVID. So I stuck them all on one side and kind of summarized them together, and Kim's going to tackle this one first.
Okay, so yeah, we did take a look at all of these different questions related to deaths, and they're very good questions. They do all seem to have a theme related to them. I know that we've heard questions about inflated death numbers and such, and I guess one of the main points I want to get across is deaths would be one of these statistics that we manage locally. So that means whenever a COVID-19 death is reported to us from a hospital or a nursing home, or some other means, perhaps the coroner's office, that does not automatically get populated into our numbers dashboard, as Alana showed us a picture of before. Each of those reports gets vetted locally by us, and sometimes requires a little bit of extra investigation on our part. I'm sure that everybody has heard that there are certain populations of people that have what we call comorbidities or underlying health issues that put them at higher risk of death and serious consequences from COVID-19. So frequently, those will be the people that do succumb to the COVID-19 virus. So it can be difficult to tease out potentially whether this is a COVID-19 related death or not. So, and just sort of summarizing all of these questions, there is a process. So it is required that a hospital, the coroner's office, reports to public health when somebody who has tested positive for COVID-19 passes away. And then at that point, that information is verified. We look at things such as how long ago was the infection. If our very first case in the county, gets hit by a car tomorrow, are they going to be counted as a COVID-19 death? No, of course not. Just because you get labeled with a COVID-19 diagnosis doesn't mean that that's going to follow you around for the next year. So there's a very careful investigation process that goes through before we report that to the state as a COVID-related death. So as far as things about how reliable are the estimates of cases and deaths, I'll talk to the deaths part first of question C, 1C. I would say that locally you can rely on our data because we're the people who are vetting this and reporting it to the state. So when the state says Outagamie or Winnebago County has 18 deaths, that our hands have touched every single one of those reports, and that we have reviewed each of them and are comfortable calling this a COVID-related death. As far as how reliable are the estimates of numbers of cases, I feel like there's another question that's a little bit further on, I believe, perhaps, where we're talking about cases. So I don't want to get the two confused. But if we're talking about estimates of number of cases, I know there are questions about, oh, well, one person tests positive 3 times, that's counted as 3 separate infections, and that's actually not true. The way that COVID-19 is reported, we keep track of people, okay? So one person gets their first COVID-19 positive. If for some reason they are tested again, either because they don't believe the test results, or initially on in the response, we wanted to have people tested and we wanted to see a negative. Actually, we wanted to see 2 negatives initially before we felt like somebody was not infectious. That's not the case anymore. But that would still count as 1 infection and not 3 if they had a total of 3. So, again, we touch every single positive case that is reported to us from laboratories and health systems. And we have a process for matching up the people. And sometimes it it can take quite a while for us to be able to match that up, but we do. We make sure that it's the same person, date of birth. If there's a discrepancy in address, we work on that. But you can be reassured that our positive numbers represent the number of people and not the total number of positive tests. And I think that that is very important. Do we want to go on to the next question slide, Elena?
Sure. I do also just want to because I know members have asked me about the reporting, and we have a City of Menasha Health Department in our jurisdiction, and we have some of City of Appleton. Can you just clarify that?
Yes, yes. Actually, so we take care of all of the results for Winnebago County, with the exception if somebody lives in the City of Menasha, not the town of Menasha, the City of Menasha, or the part of Winnebago County that is the City of Appleton. The City of Appleton and the City of Menasha each have their own health departments. So there's a little bit of a carve out in our data that we report on our dashboard. We are only reporting what is within our jurisdiction, which is Winnebago County minus those two areas that I just talked about. That's an important distinction, Alana.
All right, so moving along here.
All right, so as far as question number one, when we took a look at this, you know, that's sort of I don't know that any of us are experts on the order to bypass the CDC and send it straight to Washington, D.C. What we can speak about is locally. So no changes happened in local reporting of data. So again, you can be reassured that the data that we have for our jurisdiction in Winnebago County that we are reporting on our dashboard and that goes and gets reported to the state of Wisconsin is local data. It has not gone through any, Washington, D.C. filter or anything like that. We are the primary source of the information from our jurisdiction to the state health department. So any order that was produced by President Trump does not affect our reporting at our level. So I think that's a really important distinction. So when you're looking at our dashboard, that is truly our data. And then number two, yes, this is where I sort of alluded to that already, is each new positive test counted as a new case, even if it's from the same person. And are all counties reporting this the same? And yes, it is a statewide process. This is not a new process to us. This is the same process that we have been using for quite a while with other diseases as well. Hepatitis is a big one where somebody gets diagnosed with that once. They may have follow-up tests that are done throughout their lifetime that doesn't end up getting counted as a second case of hepatitis. Same thing with COVID-19. So it's an old process that we just are using with a new infection. And if I just could add a little bit on that, nobody asked this question, but I have heard this question raised. We've been at this response long enough now that we are having people test positive again after a period of time. And, that is a new emerging issue. At this point, the guidance that we're working under from the state Department of Health is if somebody tests positive twice within 90 days, that is still considered the same infection. I'm not sure that we have had it happen where somebody is testing positive outside that 90 days. At some point we may see that, but just based on what we're seeing right now, we are contacting state DHS and just sort of presenting our case. And I don't think we've had anybody that we are reporting as a reinfection at this point. So again, those two positive test results, let's say, for example, they're 45 days apart, those would still be counted as a single infection. Okay.
All right, those were the questions submitted prior, and it looks like Sue is your guys' leader for facilitating questions afterwards. So I'll let her take over.
Sorry, I was mute. Is this the end then? Is this the end of the presentation? We're opening up for questions?
Sorry, I wanted to. This is definitely the part where you guys can bring up any other questions. The other item that I can take some time to share is our website and walk you guys through the data displays and the communication tools that we have. But I'd like to prioritize Q&A for you guys.
Okay, sounds great. So if you recall, we have adopted some of our, the way we act, our behavior with the Civility Project, and we want to make sure that we ask questions that are to the point and that are civil. And going from there, I will be looking at the chat and bringing up all those questions. So, oh my goodness, there's a ton of them since I looked on my chat. The question says, it looks like the database reports are raw data, i.e. numbers of cases. Is there a place where we can find percentage of positive cases?
This is Doug. If what you mean by that is the number of percent positives of all tests, then yes, actually on our weekly data summaries, we have for the past 2 weeks, we show the number of tests that were conducted and the percent of those tests that were positive. Right now, we're trending upward on percent positives. We have a report that'll be coming out tomorrow, which will put us probably around a 4% positive level. We were at around 3.2%, I think, last week, looking back 2 weeks, and even a little bit lower going back. Increasing percentage of positive tests can indicate a few things. One, it's that there's more cases in the area, or two, that there's less testing available and only those that are most symptomatic actually get a test. And there can be other variables too, you know, such as the shift in the demographics of those that are getting infected, and their likelihood to be tested. So as we see a shift from towards younger ages, those people may be less likely to get a test. That also can have an impact on our hospitalization rates, as the higher rate of infections in younger persons will also translate into less hospital infections, not necessarily less cases.
Okay, thank you, Doug. Margie has a question about those people that test positive. What percent of those refuse to give you information for contact tracing? Or is that I mean, if you don't know the exact percent, you know what I mean? Is it 50%?
I can take a stab at that one, and I'm not going to have an exact percent because I think that would vary. By and large, most people are very cooperative with us, very courteous. And if they're not immediately cooperative and courteous, you know, after spending a little bit of time on the phone with, you know, the nurse investigator, the contact tracer, and giving somebody just a little bit of time to develop a rapport with somebody you've never met before and giving them a lot of information. Initially, if there is some resistance, we do find that we get calls back, or, you know, towards the end of the call, they will, you know, recall something additional. So we do have those people who flat out refuse. And that's not unique to our jurisdiction. That's, you know, across the state, probably across the country. I would assume that some people are just like, this is none of your business. I know what I'm doing. Don't contact me again. So I'm very happy to say that those are very few and far between. One of the skills that our disease investigators and our contact tracers have gotten is, you know, rapport building, trust building on the fly, and helping people kind of recall, you know, well, what other things maybe have you done in the, you know, in the last 14 days, or, you know, whatever the time period they need to talk with someone about is. You know, so they ask some prompting questions, not leading questions. They ask questions to prompt, you know, have you been to any large gatherings, what's a large gathering? Well, something perhaps, a wedding or, a funeral or, things like that, just to kind of jog people's memories. And they're like, oh yeah, well, come to think of it, I went to a graduation party, but it was only for an hour last week, things like that, to just kind of help people. We have to remember that this can be pretty scary for people. So it's not necessarily that everybody doesn't want to be cooperative, but people are scared. And they might be concerned about things like finances or, who's going to watch my kids, or, there might be other things that are preventing people from opening up. So, we are getting the opportunity to be very skilled at helping people through these things so that they can offer up the information that we do need.
Okay, thanks, Kimberly. We've heard a lot of information about wearing masks, and the question came up is, do you have research, or have you heard of any research about which types of masks are best? Because it was just something that on the airplane they're saying now the double vented masks are not going to be allowed. So who's got that question, or the answer to that question?
I can start with it, and I'm sure we'll have some follow-up. I mean, my initial response to that is the best masks are the ones that you actually wear. So let's get one, on your face first and have it cover your mouth and your nose, and that you keep it on while you're speaking. You mentioned venting. Venting masks are not very effective. The whole point of a face covering, and we hear the lingo of mask versus face covering. We try to use the term face covering and reserve masks more for like an N95 or something that protects the wearer. A face covering in this situation is really designed more to protect others, to prevent respiratory droplets from entering the air, such that they could potentially infect someone else. So vented masks may, if it's like an N95, could protect the wearer, but they don't protect others, because that vent really allows your exhalation and your respiratory droplets to really go right through right out that port. And in fact, it could even concentrate the flow of that and shoot those respiratory particles further than had you not been wearing a mask at all. Otherwise, in general, multi-ply cloth masks are going to be more effective than single ply. But really, if we can just have people wear one, regardless of what kind it is, that doesn't have a vent in it, we'll be far better off. And really, the public shouldn't be wearing, the general public should really concentrate on face coverings, not on, the types of devices that medical providers would wear, such as an N95 or an N100 or, any other advanced respiratory protection type of mask.
Okay, so this is a rhetorical question from Sue. Did you ever think you ever had to tell somebody what wearing a mask meant? Because I was at a store and a guy wore a mask around his neck and he said that counted. I'm sorry. Next question. So if a Winnebago County resident dies of COVID-19 in a Milwaukee hospital, how is the death counted?
That's a Kim question.
I feel like I should have a buzzer to buzz in on that one. We actually just had our first case of something very similar to that. And I will tell you, we didn't report the death right away. We made sure that, that this wasn't being double counted. So I'll give you an example, and this is not the example of what happened, but let's say the Winnebago County resident was seeking care at Freighter in Milwaukee, and the person unfortunately passed away of COVID-19. So it would be Freighter Hospital's responsibility to contact the health department where the patient lives. So not the Milwaukee County Health Department, but if the person lived within our jurisdiction, we would get notification from the hospital that our resident died. So it is the responsibility of the health department for the jurisdiction where the person resides to report the death. But I will tell you, in our similar instance where it happened, we did pause and make sure, since it's, this is new, remember this is a novel coronavirus, it's new, it's our first pandemic. So we just wanted to make sure we weren't too quick to hit that button and verified to make sure that it wasn't already reported.
Okay, so moving along. do you anticipate issuing a new, any new guidelines as the current guidelines are dated?
I can start with that. So the guidance that we've provided so far, still stands. We do an occasional update to it if necessary. We are awaiting right now new information from the Wisconsin Counties Association related to, what the legal standing of public health is in terms of issuing orders. And we hope to have more information about that soon. That may or may not, impact our ability to move forward with issuing actual orders versus recommendations. That remains to be seen. And so in response with that, I see one of the questions in there is what can we do? And one of the things that you can do is contact your county board supervisor and let them know, what authority do you really want the health department to have? If there's clearly a division in thought about that, but if we're gonna have uniform policies, across the county, then and the state is going to push the responsibility of defining what those policies are to the local level, then frankly, at the local level, we need to actually have the authority to be able to enforce the recommendations or orders. Otherwise, we need to have those from the state, and that's not happening. So contacting your local elected officials about what power the health department should have is definitely one of those things you can do for us.
Okay, thanks, Doug.
And-
Go ahead.
And I just wanted to add, although they might seem dated because they're from the end of May, I would say most of the recommendations are still our recommendations. We do review those regularly. They just are still dated as May because we really haven't had any updates. It's still pretty much the same safety guidelines it was then that it is now for our community.
Okay, thanks, Nikki. And if you notice in the chat, Nikki did provide us with some links to different types of face masks from articles like from Mayo and some other places. I just want to remind everybody on the call or on the Zoom that you do need to ask your question in the chat. I will not be taking open mic questions. So if you have a question, it has to come through the chat. Okay, so this goes back to procedures, and you may have kind of answered ours, which are typical for other counties in the state. Are they more stringent, less stringent, or pretty typical?
I think we could all answer this in different ways. I can take a first stab at it. So as far as the technicality of the CD disease investigation, that's pretty uniform across the state. There's rules, guidelines, processes. However, the capacity that you have around that to dot every T and cross every T and dot every I changes. And so based on the day, how many cases you have, you might have to prioritize certain work. I also think, kudos to our director and leadership that they spent the previous years really building up a health department that could build on times like these. So the fact that we have a communication specialist, a policy and equity coordinator, a planner, they're not doing their normal work. They're coming in and helping supplement this team in any way possible. Obviously, they have an expertise of what they usually are to our team, but our department has taken on so much in comparison to other health departments that I'm talking to. Many of them are just solely focused on the cases. They're not able to support their local businesses as much, work with their schools, help their universities work on reopening plans. So every health department is different. Every health department has different capacity, but we are fortunate here to have a pretty awesome team that has been very, very flexible in the last 5 months.
And to the extent that it helps, and to the extent it helps, we have a daily call with other health officers across the state to share information, to hear from DHS, to share our resources. Those topics change. In addition to that, we meet as a region at least every other week, just the health officers, to talk about what's happening in those agencies and to share those resources. And many of us sit on statewide committees that are trying to address some of the most emerging issues. Kim, for instance, sits on a statewide team for contact tracing. She's an excellent resource, for that, and is able to share her expertise with others across the state.
Okay. Fran and Elliot asked a question about how stressed are our hospitals. And I think you could look at that two ways. Are they stressed in the fact that there aren't enough beds, or are their staff stressed with the amount of work that they have to do? So maybe you could answer it both ways.
I'll start. Our hospitals became very stressed when they essentially shut down, and we're furloughing staff, and we had a deferral of routine activities because of COVID. Looking to make sure that they had enough capacity, with ventilators, with ICU space. That was an initial big stressor on the hospitals and really impacted their revenue sources. Since then they've opened back up. They are, we're monitoring daily what the capacity of the hospitals are. The Wisconsin Hospital Association does a really nice job of trending that data for us so that we can see, within the Fox Valley region, with how many patients are in the hospital right now for COVID, how many are in the ICU for COVID, and so far that capacity has not been seriously challenged. So they do have the capacity to do that, and then they've opened up for more routine procedures again, and we really encourage persons to start visiting the hospital again. It's safe to go to the hospital, and they should not defer medical care any more than absolutely necessary. We know that during the time period that hospitals were closed, things were deferred and got behind. And we really want to see hospitals be able to make that up. Those primary care visits are important. Those annual physicals are important, and certainly any persons that have any other underlying medical conditions that should have routine, medical care for, or at least consult for, should really start going back to the hospitals.
Does anyone else have anything to add to that from the team?
And I just add a different area of stress, and that would be staffing. So not necessarily just our hospitals, but our long-term care facilities as well. We had a long-term care facility who was very, very public about the challenges that they were having with COVID-19 in their facility. And when a healthcare provider, think about a healthcare provider. A healthcare provider could be a surgeon, an emergency room doctor, a CNA, a registered nurse, respiratory therapists. Potentially, these workers can get exposed outside the hospital. Like Doug said, I mean, they're doing a great job in our healthcare facilities, screening for and keeping COVID from spreading within their facilities. But, we're all people, and people have lives, and it is, there's a potential that a key healthcare provider could get exposed outside the work setting and be quarantined, or if they test positive, could be homesick. So I think that healthcare systems, hospitals, are constantly stressed about the potential when we see rises in cases locally, especially those long-term care facilities. When somebody tests positive, those long-term care facilities are not flush with staff. And when we start quarantining people and people start testing positive, it can put a stressor on a healthcare system, not because of the number of ventilators that are needed, but because the number of people that are there to care for staff, suddenly it starts to decrease because this is affecting their workers on a personal level and therefore on a service level as well. So I think there's always an underlying level of stress there for making sure that their workers are making healthy choices and not getting infected, and those downstream effects can be very concerning.
Okay, thank you. Another question came in: does the department still recommend limiting gatherings to 9 people or fewer?
I can take that again. We certainly recommend limiting gatherings, period. Putting a number is tough. You need to have, gatherings in such a way that you're able to physically distance, and that you're in a halfway reasonably ventilated environment. We know that indoor environments, really contribute to spread of COVID. And so really not having any more persons than are really safe for that space, and that you can still maintain that physical distancing in. This guidance is really just to help drive home that it's not safe to be meeting with large groups of people or with people outside of your household. Our biggest threat with this disease is the infectiousness of it before anyone has symptoms, and those that have asymptomatic infections. And by limiting the numbers of persons that you encounter and maintaining your distance, the better we can keep this under some sort of wrap or control, and not overwhelm our resources before we have other tools at our disposal.
Okay. A couple more have come in here. Thank you. Okay. What's your opinion concerning school openings? This is a couple of questions here, so I'll ask them, and then if you need for me to repeat them, I can, or you can look at them. What is your opinion concerning school openings? What guidance do you give to schools, and do you feel the current plans different? Oops, hang on, I just lost my chat when somebody shared a screen.
Mm-hmm.
Sorry.
I can start on that
okay.
while you
Thank you.
get that back, Sue.
Thank you.
So, we all want to see kids get back to school for a variety of reasons. I mean, not only academically, but, for their mental and social health. But we recognize that there may be some challenges because of the types of environment kids are in. So, most school districts, if not all at this point, have, a set of tiers that they're proposing, everything from, full in school to full virtual and steps in between. What we're doing to assist the school districts is, one, we're not making those decisions for them, but we are providing guidance in terms of what is the situation in a local community that they can factor into their plans. And so we have we have a tool that we send out weekly that'll be coming out again tomorrow, that shows by school district footprint what are the burden and trajectory of cases within that school district's footprint. In addition, how many cases are there, and what's the burden of cases in the ages of kids that are in school. So, I mean, for kids under 5, how many cases do we have? For kids 5 to 9, 10 to 14, and 15 to 19, how many actual cases are there in the community, and where is that trending, or we track that over time for them? That's one tool that they can use in consultation with us about making decisions. The second tool is what Kim's team does in terms of tracking absentees and illnesses within schools. So for years, we've been asking for daily reports from every school to let us know how many kids are absent, how many kids have a respiratory symptom or a GI symptom, and we can monitor that over time and look for anomalies, and those prompt us then to have a further discussion related to that. And so that tool will be very important in addition to our surveillance on COVID this year. And then the schools themselves are going to be an important source of information. When we have COVID cases in schools, and we will have COVID cases in schools, where are they? Are they in a particular classroom, or in a particular grade, or a particular school? What's occurring there, and then weigh all those factors together, along with non-COVID factors. What's the capacity for teaching? What's the capacity for social distancing? What are those other things that can help create a safer environment for kids if we start to see a rise in cases? Hopefully I got all that.
Okay, thanks, Doug. Anyone else want to pitch in on that? Okay, if not, I actually had a question, so I'm going to ask it now. I think I keep hearing information about how COVID is affecting children and the differences in symptoms. And so do you have any more information on, is COVID the same in a child as it is in an adult? Are the symptoms the same? And somebody told me that their grandson or somebody had COVID toes. And I thought, what the heck is that? So have you heard of this kind of stuff?
So this is Kim. I have heard of COVID toes. When we heard that, we're like, "What's a COVID toe?" And we had to Google it. So if you Google go COVID toes, you will see some pictures. I don't know that they're all pictures of children that have this this syndrome, for lack of a better word, but it mimics a different syndrome, so that it kind of piqued people's interest. I haven't heard a lot of that lately. And I'm not sure that we've had any children that have actually had COVID toes. We do see a fair number of children, you know, elementary age children who do test positive for COVID, you know, and usually that's, you know, it's spreading within a family. You know, it's difficult if you have a little 4-year-old and mom or dad has COVID. It's difficult to keep that 4-year-old from developing COVID. So most of the time we're hearing that children do very well with COVID, you know, again, unless there is some underlying disease that's going to make that child more susceptible. What we hear a lot about, and where a lot of that focus is on you know, who can that child infect? I'm a new grandma. I have a beautiful 11-month-old little baby girl, which means that my mother is now a great grandmother, and she hasn't seen that, you know, our granddaughter for quite some time, and you know, that's on purpose, because my mother has underlying health conditions. So, you know, trying to keep that in perspective, that, well, you know, children may do very well with this. This is a very contagious virus. So, you know, limiting, again, this goes back to limiting those contacts. You know, everybody wants to hold the new baby, you know, but, you know, given this COVID pandemic that's going on, if you have somebody who's has an underlying disease or is an advanced age, they really shouldn't be around somebody with COVID. So while grandmas, a lot of times we're backup childcare so that our children can go back to work, you know, that may not be there for them because that grandparent may be at greater risk. So that's something else to think about, just not how well do children do with this. It's, you know, who else can they give it to? And in multi-generational families, and we have quite a large amount of multi-generational families in our area, there's this extra layer of concern when you have a child who tests positive.
Okay, thank you. I think you can see in the chat the thank yous from various members about the presentation, all the hard work that you guys have done. And thank you for giving us your time, because we know we're stealing that away from something else that you probably could be doing. But thank you for that. So Margie, I will turn it over to you or Alana, and I'm not sure who.
I'm all for
Sure.
giving Alana the floor.
Yeah, no, yes, thank you to my co-presenters. If you guys have another meeting at 1, which happens very, very often, feel free to jump off. I'll just walk through our website information. So that's recorded with the Zoom presentation that we may or may not share later. I think that will be useful for the rest of the community as well. So Kim, Doug, Nikki, as you can tell, everyone was really appreciative, and thanks for spending time with us. Otherwise, I will just jump in and share my screen quickly. Don't feel like the rest of this information is critical. It's just kind of to help show you what's there. And once you know that it's there, then you'll be able to go back and find it later if necessary or craving that. So our website, an easy way to share this if you're talking to people is just to say winnebagopublichealth.org. It's kind of confusing behind the scenes because it's a government website, but if they type that into their search bar, that's how they will come to our home health department page, which looks like this. Under the featured topics, there's a COVID-19 right on top, and that is where you want to start pretty much for anything that you're looking for. We've got information here about testing, recent recommendations, frequently asked questions, our complaint form. So there's a lot of different information. It can kind of get overwhelming at parts. You can use the search button up here that if you know what you're looking for, you could type it right in there, and then that'll usually help you delineate some of the things that I just really want to touch on specifically are our dashboard. So it's always, if you scroll down, you can find it on that page, but you can also open it separately by clicking this link down here. And it looks like this when it's full. As we talked about earlier, it's interactive and it can change based on timing. So there's a lot of different cool features that you can look at here and find those information for yourself real time. I know that we get a lot of requests through our hotline, through our email, through our social media, asking about our data. And we are trying to be as transparent as possible. And if we get multiple requests for the same information, we usually accommodate that so that it's publicly available. So starting there is a good place. Also, our situational updates, we used to send these out daily in the beginning as information was so ever changing and we wanted to keep everyone updated. Now we send them on Tuesdays and Thursdays. So our dashboard information is updated daily, the numbers are updated daily, but we send this situational update twice a week. And if you want to come to this page, you can see all the previous ones we've sent out, and you can also click to sign up and get those emailed to you directly. Another highlight here is reporting. So as we talked about earlier, one of our big burdens on the health department is the communication. Our phone lines are so busy, and it's really helpful for us to turn things electronically. So right here is all the information we were going to be asking you via the phone anyways. So if you know of someone who has a concern, if you yourself has a concern, filling it out here is helpful because we've got the one snapshot, we know where to start, and we can dive right in. Our environmental health team has been really great watching this form. They check it multiple times a day to see what's coming through, and they can connect the dots. Other than that, let's see what
Where do we find regional information, as in the school footprint?
Sure. So the weekly summaries are the new things that we kind of started to capture what we're seeing, what we're working on. And like Susan talked about that raw data, these weekly summaries are a little bit more contextualized or put with a narrative. So if you come to this main page, it's a middle blue button right down here called WCHD Weekly Summaries. And then you can dive in by municipality, school district, or just the general. They are dated. They're created in words, so, you know, pretty simple, but it's got what you need, and you can tell it's local because it's created right here. So that's just a snapshot of what one looks like.
Okay,
Other
thank you.
questions? I did put on here our email that is general for the health department. So any questions, needs, that kind of stuff, send it to health@CO Winnebago. That makes sure that in case anybody, you know, is off in the middle of the week, that it's covered. We also do have a hotline that we are still running Monday through Fridays, 8 to 4:30. And then this FAQ was developed, and if I just open it, you can see via the table of contents that it has a lot of questions, some of which we covered today, but very general as well. So perhaps at this point you feel like you've really been following the situation, you're a little bit more educated about certain things. This is a helpful tool if you are trying to help us educate the rest of the community, to know that you're saying the right things, to make sure that we're all in the right pace, that we are giving CDC and DHS guidelines and not all just coming up with our own opinions as to what we think is best. So feel free to utilize that heavily. And when we do share the slides, all of these will be hyperlinks here that you can easily click and have at your fingertips. Are there any questions on the resources I just shared?
I think that is absolutely awesome. And I'm just so grateful to you guys for taking the time to share this today. I know that you do have many other things to do, but hopefully we'll be able to help you reach out to the county board. And that was the one takeaway I got from this, was that's the best way to help the health department as a league right now. If there are other things, hey, you've all got my email, and I'm sure you'll let me know if you think of anything else. But, oh, and wear our masks. One that we like, one that we look adorable in, preferably one that says vote.
Yes,
Does
all
anybody
those
else
things.
have anything to add? Are we good, Alana?
I think we are good. Fran asked if the link to the Mayo information will be shared on the mask, and yes, that is included in the presentation notes. So
And
we're good.
go ahead. Are you
No,
going
I
to
just
put
want to say,
the are you going to put the PowerPoint up on or just give it to us for the newsletter? Or
I'll connect with your board afterwards on how we can get this information out. But I feel like the presentation was great, and I really hope that we can keep sharing this message across our community. We're working hard here. We're tired. We don't like the COVID-19 pandemic either, but let's get through this together.
well, and
Thank
I
you.
have to commend all of you for having such happy faces to share with us, given that I know you don't have enough sleep and you're working way too hard, and we really do appreciate you very much.
Thank you, thank you.
Thank you. Thank you, Alana.
Thanks, everybody.
Thank you very
And-
much.
And we're still taking nominations for Board of Health members, so.
Thank you all.
Yes, do consider that. It's a great board to be on.
Don't they meet at like 8 in the morning or something though, 7?
Oh, no, no, no.
I'm
that later.
assuming you're looking for people with a health background, right?
Not necessarily. I mean, we have people with a health background, and we want diversity and perspective to help inform us. So no prerequisite on the health end required.
I'm just going to say, they had me for a couple of years and I have no health experience, so.
They had
Community
me,
voice.
which was 20 years.
So there are no term limits either, huh? Okay, everybody. Well, thank you so much.
Bye-bye, everybody.
Bye-bye,
Bye.
everybody.
Thank
you.
Thank you.